Vitello-intestinal duct, Meckel's diverticulum. Pathology. Persistent patency of the proximal part, the ileal part of the vitello-intestinal duct. The diverticulum arises from the antemesenteric border of the ileum within 1 to 2 feet from the ileocecal junction. Photographs, operative photographs, operative photographs, operative photographs. Clinical picture. Asymptomatic in the majority of patients. Complications occur more commonly in children than in adults. Clinical symptoms arise from its complications. 57% contain ectopic gastric mucosa responsible for the clinical symptoms. It has a unique rule of 2, present in 2% of the population. It is 2 inches long, present in the first 2 years of life. It is 2 feet away from the ileocecal junction. It is 2% symptomatic. It has 2 types of ectopic tissue, gastric and pancreatic. Complications. Peptic ulceration with hemorrhage, the most common complication. Meckel's diverticulitis, small bowel obstruction, intussusception, volvulus interlaces may be entrapped in a hernia, Littrer's hernia. It may be present with infection, bleeding, or obstruction. Painless profuse bleeding per rectum, intestinal obstruction, vomiting, pain, abdominal distension, and absolute constipation. Infection, symptoms mimicking appendicitis. Diagnosis. The majority of cases are diagnosed on laparotomy for appendicitis. Meckel's scan or RBC tagged scan is indicated for patients presenting with bleeding per rectum. Meckel's scan. Technetium pertechnetate Meckel's scan. Radionuclide imaging detects the ectopic gastric mucosa in a Meckel's diverticulum. Technetium 99 pertechnetate actively accumulated and secreted by the mucoid cells of the gastric mucosa. It has approximately a 90% detection rate in children and lower in adults. Meckel's scan false positive results. Focal small bowel pathology like intussusception and Crohn's disease, neoplasms like leiomyosarcoma, and arteriovenous malformations. Genitourinary causes like renal, pelvis, and bladder and uterus. Ectopic gastric mucosa like small bowel duplication and duplication cysts. On detection of a Meckel's diverticulum when using other nuclear methods like technetium RBCs and monoclonal antibodies. Meckel's scan false negative results. Lack of pharmacologic intervention with pentagastrin, cimetidine, and glucagon. Meckel's diverticulum, Meckel's scan. Meckel's scans. RBC tagged scan, radionuclide scan with technetium-99m labeled red cells. The labeled red blood cells circulate for 48 hours, allows for repeat scanning. Identifies sites of gastrointestinal bleeding via gamma camera scan. Detects bleeding down to rates as low as 0.1 per milli per minute. RBC tag scan. Barium meal follow through. Barium meal follow through. Management. Laparoscopic or open Meckel's diverticulum. Open surgical excision. Laparoscopic surgical excision. Good luck and best wishes.